everyone, and welcome to Synapse. This is Dr. Sonika, a junior surgical resident in India. In today's Synapse video, we're going to do a Q&A bar, an interview type of a video, wherein we will talk about the Plab exam. What is Plab exam? What are the requirements? How do you take the exam? And more importantly, why Plab? So, to help us through this and guide us through this pathway, we have Dr. Sadesh Prabhulingam, a very good friend of mine, and he was my undergraduate classmate actually. And then, after completing his internship from JJ Medical College, he went on to clear his Plab 1 and 2. And then he cleared his IELTS and got the GMC registration. And presently, he has applied for a job in the UK, and he's also finished two clinical attachments in the UK. So, who else better than him to actually uh, guide us through this journey? So, that's about Sadesh. Welcome, Sadesh, to Synapse. We had been thinking of doing this video since a very long time, and finally, here we are. Now is the time, I
Fine,
guess.
you get
Welcome to Synapse. And
yeah.
yeah, so guys, subscribe to Synapse if you haven't yet, and hit on the bell icon to get notified whenever we post a new video. So before we begin properly with the introduction and the interview part of it, let me just tell you what PLAB is. So PLAB stands for Professional and Linguistics Assessments Board. So it is the main route for international medical graduates, that is the IMGs, to demonstrate that they are having the necessary skills and the knowledge to practice medicine in the UK. Overseas doctors from outside the European economic areas will usually have to pass the exam to legally practice medicine in the UK. It is conducted by the General Medical Council of the United Kingdom. Normally, the exam has two parts, part one and part two. The part one is a written paper, which is consisting of the MCQs, or the single best answers they call. And part two is the practical exam, more like our Viva exams in our during our UG days that we have seen, and that is called as OSCE. It stands for Objective Structured Clinical Examination. So we will go through every aspect of this as we address this with Sudesh. And before that, why did Synapse actually want to make this video on Plab? Actually, there are a number of reasons. The I can think of two, three that really came to my mind. So the first one being the indefinitely postponed PG entrance exams in India, and the NEET PG aspirants are just frustrated. They keep preparing, and the exam dates get postponed. Apart from the the exam fear, or the fear of revising things, it is just mentally so draining. And that's why I think the the UG students and the post interns are searching for a better alternative. And the second one being, in the present scenario, which is in the COVID pandemic, it is so shameful to say that junior doctors and residents are being assaulted and harassed, which is, I don't know where this thing is going. And India just seems like not a safe option anymore. And the most traditional reason, or the oldest reason why students choose to go outside India, is because of the residency program itself. If you take any residency, yes, it is not easy. It is time consuming. It is laborious. You got to put in a lot of your effort. And especially if you take in do your residency in a government college in India, and definitely, like, if you take a surgical branch, you got to work your ass off. Both, it is tiring both physically and mentally. You got to put in a lot of effort. And but if you see residency in elsewhere, it is more structured. You got stipulated time for your work, and you get a better work life balance. I think that is one of the major reasons why people would want to take a presidency in any other country. So that is why we have considered Plab here, which is almost, I think, the most common routes that usually Indian graduates take to go outside of India for a better opportunity in the medical field. So, welcome, Sadesh, again. And I would like to open the interview by saying, what are your takes or view regarding this aspect, and why did you choose Plab over NEET? What was your story?
Well, you've definitely outlined all the important points. Number one is definitely my main reason to take a PLAB was a better training program there. Even though it is lengthier, it is longer, it takes a lot of time and effort. It's well structured, and finally, at the end, you will have all the skill sets that a surgeon should have, or rather, in my case, an obstetrician and gynecologist should have. So
Okay.
you'll be completely trained throughout the training program. And the second one is like a better lifestyle and a better pay. And the main thing is like the basic human rights and dignity that is expected. So you get it there. You need not ask for it. You need not demand for it. You need not struggle for it. You will get it. And as you mentioned, the work-life balance also. And then early on in your career, you will start earning, and the financial independence is also enticing. So all these reasons made me choose PLAB over NEET PG, and also NEET PG is a really tough exam to crack. PLAB is
True
relatively
that.
easier.
True
Yeah,
that. Yeah.
yeah.
And I remember
So these are the
you. Yeah, yeah. I remember you used to prepare with us during our final year, exams, and
I
during
did, I did.
internship. We
Yeah.
would sit together, do questions. We always had the plan of clearing NEET. And I must say, it was a little bit of a surprise for me when you totally changed your, direction and then plan to take up lab. I'm so happy for you today. You're just doing great in what you're doing. Congratulations again.
Thank you. Yeah, I mean, I decided the whole lab journey when I was in internship. Before that, until the fourth year, until the clinical postings and all those things, I was like, yeah, I want to do NEET PG. But then there are like pros and cons to both. NEET PG, you can stay with your family, you're familiar with the system already, you know the language very well, you know how to interact with the patients, and the training program is only for 3 years. All these things are good as well. But
And
then
most
when I
importantly, I
entered my
think,
internship,
yeah, you'll be more familiar with the system because you're grown up in the system.
familiar with the system. Yeah, yeah. So ultimately, if you're coming back to India, there's no point in training somewhere else and then coming back to this system. You have to unlearn the system, what you have learned. The whole system is different. So even though the basic motto is to treat the patients, but the system and the skills required there are quite different than the skills and talent that is required here, or rather expected here. So when I entered internship, then I got to know like the actual system, how things work, what are the expectations of a junior doctor, or rather the expectations of a consultant. And then somewhere in the back of my mind, I had the idea that what is Plab or what USMLE or other licensing exams are. But then when I entered internship, that's when I firmly decided that I am going to take Plab and not NEET PG. So I have never attempted NEET PG, but the decision was made during my
The
internship.
internship. Great decision, I must say. So, next question that we have is, what are the requirements to apply for the PLAB exam?
There are no requirements. You just need to pass your MBBS and your English language test, and you're good to go. English language test, you can prove your efficiency, or you can demonstrate your English language skills by two methods. Either it is by IELTS or by OET. And then your MBBS degree with or without internship. So for Indians, it is with internship because it's a pre-graduate internship. So it should not matter. And that's the good option as well. Doing your internship in your home country, then taking the English language exam, and then sitting for the PLABs is a good idea.
Okay. So what do you suggest, IELTS or OET? What is the difference? Can you just tell it in brief, just for the students to know about it?
But they both are English language exams, but OET, I feel like for doctors and medical professionals, it's much easier because it concentrates only on like the profession which you are in. But IELTS is more general and you'll get questions from anywhere and everywhere. So, but OET is a bit costlier than IELTS, and the frequency of the exam is a bit rarer, is what I mean. OET is conducted every month, but IELTS is conducted every 14 days. So
Okay.
that's one thing which is to be kept in mind as well. So the cost and the easiness or the difficulty level. So I would suggest keeping both in mind. I would suggest rather than giving 2, 3 attempts of IELTS, it's better to give just one shot of OET
OET.
and get done with the English language test.
Okay, okay. So I guess this is a topic in itself. We, if we keep talking about this, we'll get derailed.
Yeah.
So let's move on to the next question. What is the right time to give the exam? When do you suggest that students give the exam?
According to me, the best time to start preparing for getting your GMC registration is during our internship. But then it's also important to note that you have to build your portfolio, you have to build your CV since your med school days. It's very difficult once you have graduated. It's difficult to get into research. It's difficult to do audit projects and clinical governance projects once you've graduated. I'm not saying it's not possible, but it's difficult. It's much easier when you are in a medical college, when you have guidance from your consultants, when you have your friends to help, when you have that study population already there. It's much easier. But then to start the Plab journey, the best time is during internship. Get done with the English language test as soon as possible and give your Plab 1 exam after your internship. I have seen students or doctors who have finished their Plab 1 exam during their internship, but that requires a lot of effort and a lot of hard work. So the according to me, give your English language test while you are in internship, and then give Plab 1 as soon as you're graduated or you get your KMC, and then Plab 2 whenever you get a slot.
Okay, okay. Now, can you just brief us about the PLAB exam pattern? So, what is constituted in part one, part two? Can you just brief us about it?
Sure, yeah. So part one, as you mentioned, is an MCQ based test. It consists of 180 questions, and you'll have 3 hours to answer those questions. And it's much simple, much simpler than NEET. Because it takes into account 80% of it is mostly clinical and 20% is from like preclinical subjects, and you have like standard questions which come almost every year and few alterations here and there. But having said that, it does require its dedicated preparation towards Plab 1 exam. There are different resources which you can use. Number one is Plabable, which is quite standard. Number two, which I personally like, is Plab 1 keys. And nowadays, together, put together, exam is an OSCE exam. It consists of 16 stations, and you'll have all. You'll have psychiatric cases. You'll have communication skills cases, you'll have breaking bad news, you'll have counseling stations, you have history taking stations, you have clinical stations like IV cannulization, urethral catheterization, vaginal examination, or pap smears, everything will be there. You'll have 16 stations, and they're chosen in random. Uh, and each station will be of 8 minutes. You run through all the stations one by one, and then there'll be a minimum number of stations which you'll have to pass the exam.
Okay.
So the number of stations do vary a bit depending on that day and depending on the examiner, but you'll be informed beforehand.
Okay. Okay. Now,
So yeah, Plab 2 requires you to be, in the UK. Plab 2 can be taken only in the UK, but Plab 1 can be taken anywhere in the world. There are international centers for Plab 1. Plab 2, I would say, would require a dedicated study of at least 2 to 3 months, and Plab 1 requires dedicated study of 1 to 2 months.
okay. Now, what would you say regarding the syllabus? We'll just be a little focused. We'll talk about part one first, and then we'll go to part two. Part one, what will be the syllabus? Like, what is it that you got to cover?
Uh, Coming to the syllabus, it contains all the clinical subjects, all the questions from all the clinical subjects, and even if they ask the preclinical subjects, it would be clinically based. It would be in a clinical scenario, and then
Clinically
they'll ask
relevant.
what
Okay.
very clinically relevant. Yeah. For example, there'll be a scenario, and what will be the next step? If a patient comes with so and so complaints, what will you investigate him or her on? So this is the pattern of questions. 180 questions, 3 hours, doable. Yeah,
Okay.
with 1 to 2 months of preparation,
Preparation.
highly doable.
So you're saying give more importance to the clinical subjects and the examination part or the MCQs, which are clinically based. So that's what you're saying.
Yes,
Okay.
yes,
So I think you've already highlighted regarding the duration of preparation. So you said for part one, you need 1 to 2 months. Is that right? How
yes.
many hours of study do you really did you take into account and say it as 1 to 2 months?
I would say 2 to 3 hours per day because I prepared for Plabun while I was working. So I used to take 2 to 3 hours a day
Okay.
to prepare properly, and that took 1 to 2 months to solve
So
all the
that's
questions
doable.
and get well versed with the MCQs. Yeah,
Yeah. Okay. So could you just quickly name the resources that you used again, the Q banks that you used?
yeah. So number one, which is very essential and which is very commonly used, is Plabable.
Okay,
I
guys,
mean,
mark it.
people
Flammable
do
is
say that
important.
not
Yeah.
Plabable is important. They do say that without Plabable you can't pass Plab one.
Okay.
The second one, which I liked, is Plab one keys,
Okay.
which is like not MCQ based. They are like notes. So it's very good to revise. Plab one keys. Nowadays, med revisions and Plab verse
Okay.
are like the upcoming ones, which are good, very concise, very comprehensive, and then very easy to read.
Okay.
So these
So
four I would recommend.
so if I am thinking like a student right now, and if someone says I can afford to just buy or read one or two, so which would be your top picks?
Top pick is one is Plabable, definitely. So if you want to go for only one,
Or
Plabable
two?
is the one to choose.
Okay. Okay.
Two Plab one keys is the second one.
Okay, nice. So next, how many exams are there per year? Like if you want to give your PLAB one, so what are the months in which you can give the exam and how to plan?
It keeps changing, and I I think there is one in March, one in November. I think there are 4 exams conducted in a year. But then because of the COVID situation, it keeps changing. There's no like specific months, but everything will be updated on the GMC website. So you'll have to keep an eye on that.
Okay, so you're saying keep checking the GMC website for updates. Okay, so
Yes.
normally how like well in advance should you book your exam? Like is there a time period to book the exam?
I would say the very next day or the very day you get the IELTS or OET results, that's when you have to book. Uh, Nowadays, getting a Plab 1 seat or a Plab 2 seat is very competitive. Within seconds or minutes of opening of slots, they get over. So it's good to book your Plab 1 seat around, I would say, 4 to 6 months in advance.
Okay, hey guys, this point is important because he's saying that as soon as this portal is open, it's almost booked. So keep an eye on that, and as soon as you finish your IELTS, these are his words. Go ahead and book your slot. Okay, that was important. Next, how much does the part one exam cost to sit the exam?
Part 1 exam costs um, uh, 240 pounds,
Okay,
eh,
roughly
250 pounds,
24,000.
and then
Is that 24,000
sorry.
rupees? Is that somewhere around 24,000?
Yeah, I mean,
It
it
depends, yeah.
depends on the conversion rate.
Okay,
Around 24,000, yes.
okay, right. And where can you take the exam?
There are international centers for Plab 1. In India, you can take in Bangalore, Chennai, Kolkata, Mumbai, Delhi. There are few options in India.
Okay,
If you don't get a seat in India, you can always fly to Sri Lanka, South Africa, Singapore, Dubai. These are the nearer ones, and you'll get visa much easier.
okay, right.
The visa process is much easier.
So, could you just tell us about the application process? How do you apply for the part one exam? What are the things that are required for the exam?
Number one, and the most important, is your IELTS test report form. And you'll have to create an account on the GMC website, GMC online account. And then you'll just have to fill in all the details there. And then you can book your exam slot. That's it.
Okay, that sounds simple. Then what is the pass percentage, or in other words, how easy or difficult it is to clear part one?
I would say it's an easy exam. I would not say it's very difficult. A proper preparation of 1 to 2 months is more than enough to pass Plab 1.
Okay.
Take it from me, if I did it, anyone can do it. Any medical student can do it.
Yeah, so
Yeah, an
you
average medical
guys
student.
listen to Siddesh. You study for 2 to 3 hours, as you said. Use the materials he used, and you will be through it. And when will the
It
results
should
be
be a
published?
dedicated study.
Yeah.
They take around 4 weeks, 3 to 4 weeks.
Okay. In a matter of month, you will have your results, right?
Yes, yes,
Okay.
yeah.
Now, could we just do the same exercise for part two? So again, part two, will the syllabus be different or will it be the same?
Since it's a clinical exam, it's completely different. There's no specified syllabus for Plab 2. However, when you attend an academy for preparation,
Mm-hmm.
they will give scripts of different clinical scenarios. I don't have the scripts right now, otherwise I could have shown it to you. It's like a huge book
Okay.
with all around 400 scenarios.
Okay.
And then you'll have to go through the scripts and understand the scenarios, and then you have to prepare accordingly. And mostly it will be clinical. There's no preclinical scenarios or OSCE stations. It's
Okay.
all clinical scenarios. Like there'll be a patient, there'll be a simulator, you have to talk to them, take history, come to a diagnosis and then do the management plan and discuss and counsel all the aspects related to that disease, or rather address all their concerns and clear all their doubts. So there are various stations. There can be communication stations. There can be um, history-based stations. There are clinical stations wherein you'll have to do different clinical procedures. There'll be, interpersonal skill stations, like as in breaking bad news, or there'll be an angry patient.
Hmm.
So it all depends. There's no specified syllabus for PLAB 2.
Okay, it's more like how you communicate. It's about your personality and how you go about it.
Yes.
Okay.
Yeah.
So, do you suggest to take the help of any kind of coaching or academy for Plab B or Part 2? Is it a must?
I would not say it's essential, but 99.9% of the candidates who take PLAB 2 will go to a coaching academy to take a course there to prepare. They do help. There are four main academies, which I think all of us know about, or most of us will know about. That is Common Stations, Swami, Aspire, and Samson. I
Okay.
took Common Stations and I'm highly happy with the course.
Okay. Just
So
to
I would
mention, guys,
recommend that a course
yeah,
be taken.
this is not a sponsored video. It is just totally what Sudesh has experienced and he's telling it.
It's
So
not
we
a
don't,
sponsor video.
we,
Yeah.
it is not sponsored. No, we are not got paid by anybody and we're
Well,
not
I hope you
advertising
sponsor
anything.
the video.
Yeah. Okay. So the point is, most of them who give the exams would have taken the coaching, and to remain at par, it's better you guys, take up one of these
Yes.
coaching programs and be well prepared for the exam. Okay, then again, I think you've already highlighted the duration of preparation. I think you said 2 to 3 months is good enough for Part B. Is that
Two
right?
to 3 months of dedicated study, and these 2 to 3 months include the 15 days of the course.
Okay.
Usually, the
Okay.
courses will be for 2 weeks, and then after that, you will require 3 to 4 weeks of personal study and going through the scripts and knowing the scripts and practicing, and then you can give the exam. So it is around 2 to 3 months.
Okay.
Few doctors can give it in 2 months. I required 2 months personally. So this included 2 weeks of course and then 6 weeks of
Self
personal
study.
preparation.
Okay. So, where did you take the course, Sudesh? Is it online or do you have to go to a place, academy? Because now there is this COVID pandemic, and what do you suggest? How do they go about this?
I gave my exam this March. So I took my I took my course in December 2020,
Mhm.
last year.
I think then also the
So
COVID situation was prevailing.
COVID was not that intense in the UK. So I was fortunate enough to get a visa, and then I could fly and take up the course in person.
Okay.
Always taking the course in person is the best way to go, because you make friends there. You'll be more concentrated. You can concentrate well, and then you can make friends and you can have practice partners, and you can always practice well when you're there in the academy. But because of the COVID situation, all the courses have been changed to being online.
Okay.
At least something is better than nothing. I would still recommend that you take up an
Take up the
online
course.
course to prepare for the exam. Yeah,
Okay. Okay. So,
I took my coaching in London,
okay.
in the UK.
Okay. You mentioned it as common stations, right? That was the
Common
com-
stations, yes.
okay. Okay. So I think if everything goes fine and the COVID thingy reduces, then people who are planning to give Plab, as Siddhesh has mentioned, go ahead and do that extra effort of going in person and taking the course right there. I think it really helps a lot. Um, that's the takeaway for there. And next, how much would this exam cost? Part two. Is it expensive or? the same as part one?
It costs 875 pounds, and
Oh,
plus you need to take into account flight charges, the visa charges, and the rent and the expenditure that you in the UK, of living in the UK as well, at
can
least
you
for two
take
to
this
three
exam
months.
from India, or UK is the only center, is it?
UK is the only center. You will have to
Okay,
fly to Manchester to give this
give
exam.
the exam. Okay. How many exams will be there per year? How many sessions?
Per year, there's no specified frequency. So you'll have to keep an eye on the GMC website. They keep updating it. They'll keep opening the slots, and then you have to book slots.
Okay, the same thing holds true for part two also.
Yeah.
The seats get filled as soon as it's open.
Oh yeah, part two is even more competitive than
Okay, guys, you heard it. So you
lab
got
one.
to you got to book it as soon as it's you know uh,
Of
on the
course.
GMC the website. Okay, then the application process, is it the same as the part one?
Yes, as soon as you book your Plab 1 and after you get your results, when you pass your Plab 1, you'll on the GMC account, you can see that if there are any slots for Plab 2, you can immediately book it.
Okay.
So you need not fill any special application forms or anything like that. Everything is online.
Okay, so do you get some kind of a certificate or something after passing PLAB 1 so that you need to attach it with the application form or something?
Nothing like
Nothing
that.
like that.
Everything is updated by the GMC in
Okay,
your
okay.
account.
That's cool. That's cool.
Yeah.
Right. And what would you say regarding the pass percentage for part two? So is it as easy as part one, or how difficult is it?
Mhm. Definitely not. Lab 2 is difficult, I would say, because the whole system is different, the whole approach is different. So you need to know the UK laws, the ethics, and the
Hmm.
communication skills, the interpersonal skills. All of these things are important. So I would say it's a difficult exam to crack.
Okay.
So it does require a lot of effort. I would say, like I told you, like 2 to 3 hours of 1 to 2 months of preparation for Plab 1. I would say around 9 to 10 hours of preparation every day for 2 to 3 months is
Really?
required for Plab 2.
Okay, that's
Yes,
there's
yes.
a tremendous amount of energy, time and energy that we need to put in for
I
part
know.
two.
I know.
Okay.
It's basically practicing the scenarios from morning till evening until you get exhausted and then go to sleep, get ready
And
the
then
next
start
day,
the
go to
same
the academy
cycle.
and practice.
I think
Yeah, yeah,
that's why you said it's better if you have friends who are preparing for the same exam. You can, team
it
up
is.
and
Yeah,
do the same exercises with each other, and probably that will be
yes.
beneficial.
Yeah. Flat is an exam which you cannot prepare on your own. You will require practice partners. You will require friends to, give feedback on how you're performing and all those things. So you will require 1 or 2 people to
Okay.
study with.
Okay, okay. And what about the results? When will it be published after giving your part two?
It will take again 3 weeks, 3 to 4 weeks time to get your results,
Okay, you said that there
and
will
it will
be,
be published online.
okay, you said there'll be around 16 to 18 stations. How many is it in specific?
Yes, 16 to 20 stations,
16 to 20.
and it depends. There will be 16 stations and then 2 rest stations, or 18 stations, and then it depends. Uh, it keeps changing, so there's no specified, but minimum I think it will be 16 to 20
Okay, okay,
in a day.
right. So next, okay, is there any time limit, to take a part two after clearing your part one, or you could give, uh, uh, like, can you
Yeah,
take it up after a
you
long
could. I mean,
break?
I would say that you have to. Yeah, I would say you have to give your lab to exam as soon as you get a slot. So getting a slot is difficult than giving the exam is the
Okay.
trend now. So yeah, just keep trying every day. the day you get your Plab 1 results, log into your account and then book a Plab 2 seat.
Plab 2. Okay.
So as soon as possible. And I mean, yeah, it does require like 2 to 3 months of time in between. Plan accordingly, and the nearest possible, earliest possible slot, you will have to give the exam.
Okay. Okay. Now, let's say everything goes fine, just the way it was in your case, and then you happen to clear part one and part two. Now, what do you think is the future? What will you do after clearing Plab 1 and 2?
Okay. After clearing important three things we have discussed so far is your English language exam, Plab 1 and Plab 2. And after that, congratulations, you're done with your Plabs. We'll have to apply for our GMC registration. Once you are through the GMC registration, you'll have to apply for junior doctor jobs, non-training or training jobs. And then once you get your Crest form signed, you'll apply for your specialty training.
Sorry, what was the form? Or what's it called?
Crest form. It's called a CREST, Crest form.
Okay, what is it like?
It's like basically it will demonstrate your foundation, your skills. As in, like you have to be competent in few skills to apply for specialty training. For example, you have to be competent in ALS, you have to be competent in taking history, and there are a few criterias and competencies that you have to get signed from a consultant in the UK.
Okay.
To apply for specialty training. Basically, it's an eligibility, criteria.
So that means it's a must to work in the UK after clearing your Plab 2 and you get your GMC.
There's an option of getting your Crest form signed from a consultant abroad, but there are criterias for it as well, and they keep changing those criterias. So I would suggest that doctors go through two important blogs online. Number one is Road to UK, and the second one is Savvy IMG. So these two are very important blogs that you guys have to go through before embarking on the Plab journey. So go through the blogs and the websites completely, thoroughly understand the whole journey. And they're very good to read through, and they're very concise, very easy to read as well, and they give up-to-date information. So there are like so many blogs, so many websites online, but not all of them are up to date and not all of them are accurate.
Correct.
So these two are the ones which I refer to, which I'm still referring to them. So number one is Road to UK and Savvy IMG.
Okay, guys, make a note of these two blogs. Make sure you go and check them out so that you get a complete, comprehensive information regarding what is Plab and what you're getting into. So, okay. Now, let's see, you've cleared your Plab, you got there, you got your Crest's application signed, and then that's when you apply for specialty training, is it? Or let me put it this way. What are the options? What if you don't want to get into training? What if you just want a simple job? Or what if you want to take up training after a few years of, just settling in the UK? So what are the options out there after you move to the UK?
So after you get your GMC registration, we'll be working in junior level jobs. It can be either foundation year jobs like foundation year 1 equivalent or foundation year 2 equivalent or specialty trainee 1 equivalent, or there can be like trust grade jobs or non-training jobs, which we can apply online and then give the interview online. And once you get the job, you can relocate to the UK. You can work in those jobs for however long you want to. I mean, they pay you from day one. So you can work for 1 year, 2 years, 3 years in your desired specialty. But it is also important to keep in mind that few specialties have like cutoff experience. Like for example, in Obs and Gynae, you can't apply for Obs and Gynae ST1 post, specialty training post, if you have more than 24 years of experience in obs and gynae. So you'll
Oh,
be deemed
okay.
overqualified for applying for ST1. So
Okay.
you have to keep in mind that criteria too. So in that case, I can work in obs and gynae and get experience for 12 months. And after that, I can work in a different specialty, which is related to obs and gynae, like neonatology or general surgery.
Okay.
So you have options for that. If you don't want to get into specialty training, you can work in like junior doctor positions for however long you want to. Or if you don't want to get into specialty training, you can just work as a junior doctor throughout your life.
Okay. Okay. And here's one more question, which is most frequently asked. How long does it take to be a consultant in the UK? Uh,
Well, that's a very difficult question to
exactly.
answer because it depends on the specialty that you choose. Few like if you want to become a GP consultant, you can become a GP consultant in 3 years. I mean, what I mean is GP training is for 3 years,
Okay. Okay.
and if
GP is
you want to become an obstetrician, it will take a minimum of 8 years, and it depends on the specialty which you choose. There's no specified duration of time in which you'll become a consultant. And
okay.
also, few people would be willing to work in a non-training job before you apply for specialty training for 1 year.
Hmm.
Few would require 2 years, and then you might not be successful in your first attempt. Or even in your specialty training years, few people might take 8 years to get CCT, few people might take 7 years to get CCT. So it all depends, it's highly variable.
Okay. So, on an average, just to brief up, to complete your GP training, you need 3 years. And I think from what knowledge I have regarding surgery, you can finish your ST, basically specialty training, in like a period of 8 years. That's what it takes. If you join ST3,
Yes,
it will go on till ST8. So that's that. And
yes,
as you said, obs and gynae again 8 years. So it takes
yes.
a variable amount of time because the choices are varied, and the time taken to be a consultant in different fields is different. So that will be too diversing at this
Yes.
moment. So that anyway was the most frequently asked question. So that's why I wanted to ask you that question. And